Hi, this is Dr. Rosenberger with Appalachian Spring Dermatology, and today we're doing a series of videos talking about laser and intense pulse light treatments in our office. I encourage you to take a look at all of these videos when you have a chance. Today we're going to talk a little bit about treating veins with the laser. So in our office we use a laser that uses a single wavelength of light, as all lasers do, and this one is a 1064 NDI. When we're treating face veins, what we're doing is we're targeting the blood in the blood vessel so that when the laser hits the blood in the blood vessel, it heats up the blood, and for lack of a better description, I use the word heat, and that energy causes destruction to the lining of the blood vessel. So what happens then is that blood vessel, if you think of it like a hose, is no longer a good conduit for blood flow. And once it's not a good conduit for blood flow over time, the blood vessel just dries up and goes away. So when we see our results from treating face veins, what we're seeing initially is just the laser push the blood out of the blood vessel. The actual blood vessel is not removed until the body comes along and cleans up that old hose that's not functioning properly anymore. That's my best way of describing it. So with this, we're going to chill the skin with the tip. So this is a gold-plated tip that actually has water circulating through it, and it's actually very cold on the skin. So we're going to chill the area. The goal is to protect the outer layer of the skin so that that energy, again best described as heat, doesn't bubble up through the skin. So you saw I applied some clear aloe vera gel to her skin, and this just helps transmit the cold better, but also helps the laser glide a lot when we're using it for laser hair removal and other things. So here we go. 1, 2, 3. This actually saw her flinch a little bit. This crevice of the nose is very tender. You know, I do procedures all over the face all day. And this little crevice of the nose is probably the very most sensitive spot on people. So some patients come in and they actually have a whole nose full or a whole face full of veins, and we'll post some before and after pictures of those. I usually tell patients that you will see at least a 75% improvement in the veins with the first treatment. I've figured out over time that face veins are like a lot of things in life and in medicine, and that is that people get more picky with time. So they'll start out being concerned about this big vein, and we get rid of it, and then they're concerned about this sort of small one, and then we get rid of that, and they're like, there's this one I can see in my magnifying mirror. So I never promise 100% result on one treatment, but it does a great job and can really remove a lot of those streaky veins that are on the face in a very short amount of time. There often is a little bit of redness, almost sort of looks like you scratch the skin, or a tiny hive-like response that lasts up for a half hour and up to a whole day, depending on how many veins the patient has. But it does a great job. She did wash her face prior to the procedure, and we will have her apply some sunscreen in our spring boutique prior to leaving. Thank you, and have a great day.
Call for an appointment today and learn more by going to our website at wvderm.com.